All right, good morning, everyone. I just want to say welcome to the Wellness and Recovery series. It is Tuesday of our last week of the Wellness and Recovery series. I just want to thank you all for joining us, whether it be Zoom or Facebook Live. Today, we'll be going over the overview of the NCHIIN Resource Hub and the Del Norte expansion. And our presenter today is Patty Torres with Humboldt IPA. Patty, would you like to introduce yourself?
Yes, hi. My name is Patty Torres. I'm the project manager for the North Coast Resource Hub, and thank you for inviting me today to give you an overview of the hub and also talk a little bit about the expansion into Del Norte and Curry County. So yeah, thanks for tuning in and for inviting me.
Yes, thank you for being here. We really appreciate you joining us today and giving us your wonderful presentation. We're really excited, and I just want to say again, thank you to our presenter for joining us and those watching. We do want to remind everyone who is on Zoom that you will be muted and your video is turned off. Sorry. If you have any questions, you are welcome to raise your hand or type it into the chat. And if you are on Facebook Live, we will be having people monitor the chat. So if you have any questions there, you're welcome to leave them and we'll make sure to get to them as soon as our presenter is ready to open up for questions. There is about a 45-second delay on Facebook Live, so just keep in mind that it may take a second for us to receive your question. But before we get started, as always, we want to go through a little bit of housekeeping. We'll start off with, of course, our group agreements. So we do want to remind everyone that respect and kindness are key. If you're not being respectful and it becomes a persistent issue, you will be removed. Please show tolerance and sensitivity for differences. Participants in the group come from different cultural, racial, gender, and sexually oriented backgrounds, so please be aware and sensitive to judgmental comments. Please try and use positive language and stay away for sure from using racial, homophobic, and degrading remarks. This is a safe space and free of judgment, and it's all right to disagree with someone else's point of view, but we don't put each other down for it. This is a space where participants should feel comfortable to be themselves, share their thoughts and ideas without any worry of punishment or judgment. For those who may be sharing stories today, if the participants or those in the chat are sharing personal information, try and leave out specific names in your stories, because using names often aids in the spread of rumors and detracts from the point of the information trying to be communicated. So we ask that out of respect of others, try and leave names out if you can. And as always, if you don't understand some of the information being provided today, ask for clarification. Again, we have the chats open on Facebook Live and Zoom if you have any questions. So don't be afraid to ask questions. We also want to remind everyone that sometimes in these conversations, it could bring up some feelings or concerns, and we want to let you know it's okay to reach out. We've provided some resources here for those who may want to reach out, such as the mental health hotline for Del Norte and the 24-hour crisis services that are available. As far as informed consent and privacy, each person's participation in this presentation is voluntary. So please respect the privacy of others and do not share personal information with anyone else. This training is being recorded and is live on social media. So if you are participating via Zoom, please turn your video camera off and stay muted. And we always want to start it off with a land acknowledgement. I personally want to acknowledge that I am meeting from Talawadeni lands up here in Northern Cali. And if you aren't sure of the lands that you're coming from today, you should research it and find out where you're meeting from. Some of the common areas that people are meeting from are Talawadene, Yurok, Karuk, Hupa, Wiyat, and some of the many rancherias such as Elk Valley, Rezagini, Big Lagoon, Trinidad, Blue Lake, Table Bluff, and Bronerville. So again, you may be meeting from somewhere else, so try and recognize the land that you're on today. And we honor the Indigenous peoples who lived together and cared for this land and each other since time immemorial. We honor the gratitude, the land itself, and the people who have been the stewards of this land for generations. We know the effects of colonization have impacted Indigenous people disproportionately, and we hope that through this series we can learn together to help heal and work towards a healthy future. So again, thank you everyone for recognizing where you're coming from today, and thank you to our presenter for being here today. And I'm gonna pass you the mic, Patty, whenever you're ready.
Awesome, thank you. I'm gonna go ahead and share my screen. Can everybody see the presentation?
Looks great.
Okay, wonderful. So again, I'm Patty Torres, and I am excited to share this resource with you today. It's a work in progress, and I welcome any questions along the way. Just feel free to either type them in the chat or just pop in. I don't mind that at all. So for today, I'm going to start off just giving a little bit of background on how the North Coast Resource Hub came to be. I'm going to walk you through a short demonstration of the Resource Hub, just so you're familiar with all the features and the content and how to get the most use out of it. And then I'm going to forecast our next steps with the Resource Hub, and also have some time at the end for questions. But like I said, feel free to pepper those in as they come about. Okay, so what is the North Coast Resource Hub? It's an online, mobile-friendly resource guide, and it features community, social, and some medical services. So it's not an app, but it is designed to be functional on your mobile device. It has search features to narrow down results. So in a moment, when I walk you through the demo, I'll show you how you can apply filters like a broad category. If you are working with a client who has private insurance or Medi-Cal, I'll show you how to narrow down those results. And then we also have the ability to search by location and then add a search radius. So if your client has transportation challenges and they can only access resources within a certain radius, there's the ability to apply that. And then we also have bus routes. So when you look at each feature, there's a map, and then the map shows the icon for the bus routes that are nearby. The target population is pregnant women with substance use disorder or at risk for substance use disorder, but we're expanding. So because there are so many resources out there in the community, we thought we have to start with a population in mind. And because initial funding for this project came from a grant that was specifically for pregnant women or parenting women with substance use disorder, that was a population that we were going to start with. So what are the resources that serve pregnant women and the intersection of that with substance use disorder? Also, our primary audience are case managers, navigators, social workers, so professionals or paraprofessionals that are working with clients. We continue to explore what it's like to have a resource that is made for the case manager. So what is information that the case manager needs, and then also making it more layperson friendly. So that's something that we're currently working on, is how do we meet that middle ground, and how do we add language that is familiar to the layperson, but also maybe it's not the language that the case manager would use. And so we're working on features to help facilitate that. I'll give you a little bit of background on the Resource Hub. So, this started because we participate in a variety of community forums, a variety of stakeholder groups, and we hear a lot about the need for a centralized resource that has features to help navigate clients into services. There's a lot of really great resource lists that exist already in the community, But there's challenges surrounding that, right? Sometimes those resource lists are crafted for specific populations, so they might not apply to the clients that you're working with, and they're not always kept up to date, which is understandable, right? Things change rapidly, and it's difficult to keep on top of all those changes. So we heard a lot that, you know, there's lists, but they're not always kept up to date. They don't always have all the information that I need, and they don't always apply to the people that I'm working with. The Humboldt RISE Project is a project here in Humboldt County that is a multi-organization project. It's supported by a grant funded by the Wellbeing Trust in partnership with St. Joseph Health System. And it's focused on serving the pregnant population with substance use disorder. So we received this grant, and one of the goals was to create the North Coast Resource Hub. So we decided that we were going to start off with a resource that was fully online. It's important that it's mobile friendly for the case managers that are out in the field. And we were going to focus it on the population that was pregnant or parenting with or at risk of substance use disorder. And so another quote that I included here, just because it sort of speaks to, you know, what we have continued to hear, is that, you know, I would say we have a lack of knowledge of referral sources that we could send patients to. You know, the SUD program at the county, I know it exists, but I wouldn't know how to get anybody enrolled in. So because people are busy, especially, for example, in a prenatal care setting, medical assistants or nurses don't always know what's out there to support their patients. And so, yes, I know that there's, you know, this program, but I'm not necessarily sure what the hours of operation are or what the eligibility requirements are. Or sometimes you have folks that are really knowledgeable that have been in the community for years and they know a lot. But sometimes it's hard when that knowledge lives with that one individual, right? Because when that individual, you know, switches roles or leaves that organization, there's that gap in knowledge again. Like, oh, you know, so-and-so was the one that knew all about that. So this started off as really trying to meet that gap of how can I find resources quickly that my client or my patient is eligible for. So just a quick review of the timeline. So in the fall of 2018, the grant was awarded. All of 2019 was kind of the data collection and the build phase. So luckily, through a different project, we had already embarked on a data collection process. So we already had a lot of robust data on existing substance use disorder resources in Humboldt County. So it was really useful to take that information, call and get some updates, and then use that as the base for the resource hub. We also used a similar template to gather data, right? We wanted to know things like, what are the operating hours? What are the eligibility criteria? How is this funded? How do you get clients in? So we already had a lot of that baseline information. And then the building of the resource hub began, right? You know, we knew like the skeleton of what we wanted it to be. So we wanted it to be online, we wanted it to be mobile friendly, and we knew we wanted it to be a list that you can sort of apply different filters and narrow down results. And then there was a discovery phase, right? We took a lot of time to really go out in the community and understand what else would people like to see in a resource like this? What would be useful? So we did a focus group. We did various presentations. For example, one of them was with public health nursing programs. And we did a Facebook survey, a Google survey. So it was a lot of asking what is useful here, or maybe, you know, what feature is not maybe serving its purpose or could use improvement. And so by early 2020, we had the beta phase of the website ready to have a soft launch. So we initially shared the resource hub just with kind of our inner circle of stakeholders. The RISE project has a steering committee that is comprised of members from a variety of different organizations, like First 5 Humboldt, like all the, you know, the hospitals, Mad River and St. Joseph, and a lot of the prenatal care practices, Open Door, so a lot of different partners. And we said, please test this out, please share these with your colleagues and let us know how it's working out. And so that's you know, the early phases of this year. We took that feedback. And this summer, so summer 2020, we contracted with RxSafe Del Norte to expand the resource hub to Del Norte and Curry counties. And so this is our current activity of the moment, is to reach out to colleagues that are in Del Norte and Curry County and gather that information and expand the reach of the resource hub. So as you can see, it takes some time to build something like this, and there's a lot of going back to the drawing board, and there's a lot of just having patience with the process of, well, this isn't working the way I would have liked it to work. Let's see what we can tweak. Let's see what we can change. So that's where we're at. What makes the North Coast Resource Hub different? Okay, I'll go through this quickly because I want to get to the demo part. But like I said, we took a lot of time to listen to the community. I think that is something to be really proud of with this tool, is that there was really a lot of effort into hearing from others as to what would be useful. We make an attempt at collecting more in-depth information. So we want to know specifically, what's the referral process like? Does the client need a referral from a different entity? If so, what entity is that? We like to know if there are different languages spoken for populations that may not speak English. We want to know if there are fees associated with the service. And if there are fees, are there payment plans? Or is the insurance billed? Or are these services of no cost to the client? And then we also have the filters that we're very proud of. So location, insurance type, population, and then a simple text search. So all these things are, I think, what sets the Resource Hub apart, and we're actively working to optimize those. So I'm going to now show you the Resource Hub. Bear with me here. Can folks see the Resource Hub home screen?
Looks great.
Okay, perfect. So when you go to resourcehub.nchin.org, this is what comes up. So this is our homepage. I will walk you through these tabs here. So about, this gives the blurb of the Resource Hub, just talks about some of its background that I just went over with you and the goals of the hub. And then here, if you click Search Guide, this shows you kind of how to get the most out of the hub. So we introduce the filters, the text search, we define what a filter is, we describe all the filters. I'm not going to go into detail here because I'm going to walk you through it in just a moment. But this is something that if you're using this or if you're sharing this with a friend, there's this guide here that kind of helps break it down. So there's that. I'm going to go back to the home page. And so starting here, a basic text search, right? So there's the ability to type in, if you already know what you're looking for and say you just need the phone number, you can type it in. Something that we're actively working on is a synonym feature. So for example, if someone is looking for addiction services, but the word addiction is not found in the resource, the word that's found is substance use disorder or medication assisted treatment or Suboxone, what you type in here is going to be linked to that word. So addiction is going to be linked to substance use disorder, medication assisted treatment, Suboxone, etc. So that's a feature that we're working on there. The category filter, we have several broad categories of services. And if you hover over this eye here, it tells you, what this does. So for example, I have a client I'm working with, and this client is unhoused and I need clothing and hygiene services for this client. And in addition, you might also need children and family services if you have a client who is also in need of childcare. So you can select a number of resources here, and it shows you everything that is associated with those broad categories. Okay. There's the insurance type filter. So for example, you have a client that has commercial insurance only. So what this does is it brings up resources that accept commercial insurance, but also resources that don't accept insurance at all. Services that may be free, services that, you know, are community services. The intention here is not to accidentally weed out services that your clients or your patients might find useful. So it's a list of both what accepts that particular insurance type and then other things that don't require insurance. And then there's the location filter. This is connected to Google Maps. So for example, if I type Crescent City, it pops up what's in Crescent City with a radius of 10 miles. And I can expand that more if I would like to. So I can expand that radius all the way to 50 miles. We do have more services with Del Norte, but they're not quite ready for prime time. We are currently working on gathering all the information that's needed before we display them on the hub, because we don't want to display anything that's not complete. So we're working on this part as we speak. So now let me take you through one of the sort of detailed ones, right? So let's see, let's do ages. So link will take you to the website link. And then if you click details, what we have here is a more detailed view of Aegis Treatment Center. So this initial paragraph here is going to give you a broad overview of the service. And then to the right is a map. Again, this is linked to Google Maps. So this red dot here is where the resource is found. And then if you get a little bit closer and you would like to see where the bus routes are, you hover over these icons that have the bus route. And then if you click on them, it shows you what route it is. And so if you then click Google Maps, it can take you to the bus schedule that's associated with that. I'm going to pause there and just check the chat here. How often will I edit this document to ensure that it's accurate? So our hope is to be able to revise every resource at least twice a year. Right now we're in the build phase, so we haven't gotten to the point of having to go through the revision process, but that's what we have so far, and we've consulted with others who also manage big resource lists, like from the county. You might have seen that giant, beautiful, I think 30-page resource list that the county and St. Joe's work on collaboratively, and they said, you know, twice a year is what we aim for. So that's what we're going to aim for too. So moving right along, there's the address, there's the contact information, and then the hours of operation. I also want to note that if you're using your mobile phone and you're looking at the address here, you can tap on it with your finger and it brings up Google Maps. And if you tap on the phone number, it'll pull up the number on your phone and call it for you. So another button here for the website. And then we have the description, a bit of a more detailed description of the services. So this is an addiction treatment center. We're also working on adding the ASAM level of care determination. So this is a 2.1 intensive outpatient treatment facility. That becomes important when now that Drug Medi-Cal is live, and patients need to be able to go to the treatment center that meets their level of care. So we're working on including this wherever appropriate. And then we have a more detailed list of services. So for example, AEGIS provides medication-assisted treatment. They're a naloxone provider. They provide outpatient individual counseling services, outpatient group counseling services, recovery services, and case management. And then detailed information here about, do you require referrals? Can a client self-refer? Is prior authorization required? What licenses and certifications are available at this resource? What assessments are used? What languages are spoken? Is there a fee for service? And we have here, yes, you know, insurance is accepted, and there's also a sliding scale payment option. The age criteria is 18 plus, insurance types, and then all the different populations that are served here. We also down here have a button, so if you are a manager of one of these resources and you see something that's not quite up to date, you can always click here and report that change, and I get that email and then I can update that for you. Okay. So I think that is the broad overview. Are there any questions at this point? I've done a lot of talking.
I'm not seeing any questions yet, but they may come up a little bit later. We understand that sometimes there is a delay with the Facebook Live. So if anyone has any questions, you're totally welcome to leave them in the chat and we'll get to them as soon as possible. I kind of have a question of how did you get into this work?
Like how did I start working for this organization, or the Resource Hub specifically?
I guess this organization and the Resource Hub, like how did you just start getting in? Oh, what interested you, I guess?
You know, I started after I graduated college. I worked for the Wiyot tribe in the Natural Resources Department, and I was introduced to the world of nonprofit, of managing grants, of writing grants, and executing projects. And that really, you know, made my heart happy because I love organizing things and I love like designing something and seeing it through to the end, and just all of that really spoke to me. I think I have a tendency towards liking to create things, and I just really liked it. And so as I learned more about just the history of tribes, and then I learned more about how, you know, this country hasn't always provided equal opportunity for people of various backgrounds to achieve their goals. And so that really motivated me to move to a job where I could potentially make a difference. And I think that I found that here with the North Coast Health Improvement and Information Network. We manage a variety of projects around community health improvement. And so that is just really fulfilling work. So that's how I landed here.
Wonderful. Thank you for sharing that. We did have a question in the chat asking, how will you promote the Resource Hub so people know about it?
That's a great question. So because at first we intentionally did a very contained launch of the hub, we didn't want it we didn't want to promote it far and wide yet, because we wanted to make sure that everything was functioning well, and that we could optimize what we could optimize before sort of expanding that. So now that we are sort of working towards that, number one, the Resource Hub is going to go on some resource cards that the Yurok tribe and the Humboldt Harm Reduction Coalition created. So that's going to be one way in which the hub's going to be out there more. What else? We just plan on working really closely with RX Safe Del Norte also in expanding it and, you know, making it well known in Del Norte and Curry counties. And then we continue to spread the word at our different stakeholder meetings, like RX Safe Humboldt, like the Humboldt Community Health Trust, just different stakeholder groups. We continue to promote it.
Wonderful. We also had another question of, have you considered putting this into an app? Because is there a way we could use the hub offline for people in more rural areas?
Yeah, so our initial goal was to make it an app. Then we came across some challenges on the programming side. So there are some, I think, practical challenges to making that happen when you're working with resources that have to be continually updated, and an app, like, I believe, I'm trying to recall the way our awesome programmer explained it, there would be a need of constant needing to download different apps because of the different upgrades and different updates that would happen. So having an app was not the best way. So it's a mobile friendly website. The other thing that I forgot to mention is that for folks that are in outlying areas where they might not have reception, there's the ability to print resources in a way that prints well. So if you select resources on the guide and then just hit print, there's the ability to have those in hard copy.
Wonderful. I think that's fantastic for rural communities.
Yeah, thanks. And then the last part of the presentation was just kind of talking about what we have coming up next, if we're ready for that, if there are no more questions.
None yet. I guess there was one asking, like, how do you see this resource helping the community? Like, how does it fill the gaps we often see?
Yeah, let me jump ahead a little bit to address that question here in my slides. So one of the lessons that we've learned is that resources exist in the community, but they're not always easy to find. So as we've gone about obtaining information to collect data for the Resource Hub, we hear a lot of people say, not everyone knows that we exist, and we would like people to know, because I think the nature of community and social services is that they change depending on funding availability, right? Some years you have funding for your program, some years you don't. That means you have to reduce your hours, or that means that you have to change the eligibility criteria. Like, if you were able at one point to serve everybody, then you have to be a little bit more narrow in who you serve. And so that contributes to not always being able to promote your service, or keeping resource lists up to date with the most current information, just because things change so much. I mean, just look at with COVID right now, right? That has just changed the landscape so much of the way that services are delivered. And so the gap that I see this filling is that it's going to be a resource that is kept up to date, that you can go and apply the search criteria that meet your needs. Like, I identify as a woman, I'm currently pregnant, and I need to access medication-assisted treatment that's within, my neighborhood. So I hope that it becomes a tool that folks know that they can trust, and that they can find what they're looking for quickly without having to make a dozen different calls and be routed in a dozen different directions.
Wonderful, thank you.
And so with that, I'll go back to my previous slide of upcoming developments. So like I said, number one, we're really excited to have partnered with our Safe Del Norte in this. I mean, it's really great and exciting, and that there's going to be this one resource where you can search in such a big chunk of the North Coast, right? Whether you're in Oregon or in Del Norte or in Humboldt, because we know that that people here move around around, you know, these rural areas. And it's important to have a tool that encompasses those places and is reflective of more people are accessing services. So that's really exciting. We are also working on adding a crisis screening. So when you first access the website, there will be a question that comes up immediately and says, are you in crisis? And if you say yes, you will immediately have resources that have crisis hotlines or crisis services or walk-in services available. And if you click no, then you can continue as usual into searching for resources. We're working on the ability to be able to text resources, because while the printing feature is neat, not everybody has access to a printer. We're working on adding the ASAM level of care determination. We're working on integrating the alternative pain management guide, something that was a partnership between RxSafe Del Norte and RxSafe Humboldt, into guiding people in accessing resources that were not opioids that are designed for pain management. So we're going to fold those into the hub. Like I mentioned earlier, we're working on adding layperson friendly language. So that's something that if you have suggestions, please let me know. Please email me or let me know in the chat of, you know, Patty, no one says naloxone, people say, you know, the different term or whatever that may be. We're working on being able to translate the hub into Spanish, so, and other languages if possible. So you know how if you go on a website and there's a Google feature that allows you to click and it translates everything for you. We're currently seeing if that's something that would work for the resource hub, or if we would have to do more of the manual translation, which we can do also. And we're working on a logo development. And so a lot of things, you know, this is something that continues to evolve. And so hopefully once we have a logo and a beautiful color scheme, the front end of the webpage will look different. And also hoping to just improve the user experience. I think there might have been a question in the chat. Let me see here. Thank you, Phil. It's nice to work with you. And so just going back really quick to our lessons learned, like I mentioned, you know, this is something that it takes, creating a resource tool takes resource, right? Now, since we've sort of embarked on this journey of creating this tool, we've learned a lot about how it's hard to keep these up to date because things change so rapidly. And it's important to take the time to listen to what your community needs. I think that it's important to take that time, right? I wouldn't have imagined, I think at the outset, that this would take a year to build, but yet it's taken that long to produce something that's really designed to help fill those gaps that are in the community. And it's a work in progress. We often, you know, talk about how can we improve this filter? How can we just make things easier to find? What else can we do? What can we tweak? So those are things that are happening on an ongoing basis. And so the hope is just to make something that's going to be useful, hopefully for a very long time. And with that, whoops, okay. So there's my contact information. Please, if you would like to see your program, if you are located in Humboldt or Del Norte or Curry County and you have a program that serves the community, please let me know. Please, let's find a time to connect, and we would love to include you in your program in the North Coast Resource Hub. And with that, that's it for me.
Wonderful. Thank you so much, Patty. A wonderful presentation, and we appreciate you sharing your resources. It's so important to our communities. And like I was saying in our last presentation where they're sharing resources, it's something that, you know, I feel like needs to be refreshed and reminded for people to stay up to date. And so, yeah, again, thank you for joining us today.
Thank you.
And is there any last, you know, words or advice or just recommendations of resources for people you'd like to leave the group with?
I would like to again plea, if you know of resources that you would like to see on the hub, let me know, and I'm happy to contact the appropriate people and get them added into the hub. So please let me know. Feel free to call or email anytime.
Wonderful. Thank you so much, Patty. We appreciate having you today. We did have one more question. They want to know, what are some of the tools you used while dealing with the pandemic we all face?
Philip, can you, what do you mean by tools? Just want to make sure I answer your question appropriately.
I think this one may have come from
a
watcher
Facebook.
on Facebook.
Okay. Mm-hmm. What are some of the tools you used while dealing with the, you know, I think the great part about this work is that it can all be done virtually, like to gather information. I've sent folks Zoom invitations, and that's how I gather the information to input it in the resource hub, or over the phone. In the beginning, before COVID, it was great to be able to go do like an in-person interview, just to like meet the person face to face and start building a relationship. But of course, that's not possible now, although Zoom has worked really well to gather that information. And, you know, the creation of this is done remotely through our computers. I don't know if that's what if that's what this person was asking specifically about. So I would like to maybe just pause and see if that's what they were asking about.
Definitely, yeah. We often say, like, answer the question that you wish they asked. Sometimes it's a little hard between Facebook Live and here, but yeah. Again, I just want to say thank you. We haven't gotten a response yet from our question asker, but if people have questions in the future about this, can they just contact you, or what do you think is the best way to get these questions answered?
Yeah, email. I can leave it in the chat box too. Email is great, or phone number. I'll leave that in the chat box as well.
Wonderful. Well, thank you so much. We appreciate, again, this entire presentation. And yes, the person who was replying said that they were looking for resources.
Yeah, if they're looking for resources, they can use the resource hub, and specifically because things are changing so rapidly, we haven't made those changes in the hub. So for example, a community resource center, if they are doing only virtual services, but maybe have just recently switched to limited in-person services, that change hasn't been reflected in the resource hub just because it's so fluid. And we were asked specifically not to do that by a lot of the program managers, is don't change it because it might change next week. So I would encourage them to call the service directly and inquire about the status of their services.
Wonderful. Well, thank you so much, Patty. We appreciate all the information. And we are going to leave all of the contact information for Patty in the chat, so that if you have any further questions, you can reach out and get some more information on this if you'd like to know more. It will be included on the Zoom and the Facebook chat. So again, thank you so much, Patty. We appreciate having you today. And we hope to hear more from you in the future, and we're excited to see updates and see this as it grows. So thank you so much. And
thank you.
Let me, so before we get off today, as always, we just want to say thank you to our presenters and all of those watching today. We are the Wellness and Recovery series, and We're on our last week and we're sad, and we're also happy because it's been an amazing month, but we want to remind everyone that we still have one more week and you can still register through Eventbrite. I know it seems kind of silly on the last week, but it isn't, because you can still get information for what's happening this week and even information on what's already happened. If you haven't gotten your order in for your Wellness and Recovery Series t-shirts, you can do that through Eventbrite. So the link is still here and you can still go check it out. I also want to remind everyone that we do have our RX Safe Del Norte YouTube page, where we are uploading all of our presentations from this past month, so that if you missed them, you can still go watch them, even the trainings, and the information will be in the description. So make sure you go check out our RX Safe Del Norte YouTube page if you missed some stuff and you want to see what we've been doing this past month. Like I said, it is last week and we will be ending on July 30th, but we will have tons of presentations today, Tuesday, and Wednesday and Thursday. So make sure that you jump on and join us for this last week. We still have Wellness Wednesday, and make sure you come in, and I think we're gonna do some movement, and so make sure to join us for that last Wellness Wednesday as well. We will be on Zoom and Facebook Live, and if you want to stay updated, you can still register at Eventbrite or follow our Facebook page at the Wellness and Recovery Series. Again, we still have the Wellness Art Challenge going on. The deadline was yesterday on Monday, but we are going to still accept submissions. So if you still want to do it last minute, you can download the PDF of the Wellness Art Challenge on our Facebook page or on the Eventbrite. So what we ask is you draw what your wellness activity is. And it doesn't have to be a drawing. It could be any medium. It could be writing. It could be a video, a picture, anything you'd like. But we ask that you take a picture or scan it in and upload it to social media and use the hashtags HealthyDelNorte and Wellness Challenge. Or you can email it to us directly at rxsafedelnorte@gmail.com. Make sure to include the artist's name and age group, and it will be included in a raffle announced on Thursday. So make sure you get those submissions in. I know it is last minute, but we're still accepting them. So make sure you join in on the Wellness Art Challenge. And it is our last week. As always, we are going to do a quick overview of the week. We've got, this morning, we had a lot of resources given to us today. And so a lot of that information for those resources will be on our Facebook and our Eventbrite. So make sure you check them there if you still want to reach out and find out more about those. This afternoon at 2 p.m., we'll have an amazing presentation from Shauna McCovey, who is the author of The Smokehouse Boys. And she will be kind of elaborating on one of her poems that talks to addiction. And this evening, we'll have a wonderful presentation from Dr. Groves at 4:30. So make sure to tune into those this afternoon and evening. Tomorrow is our last Wellness Wednesday, and we'll always start out the morning with the UROC Health and Human Services hosting their presentation with Boyd Ferris at 10 a.m. So make sure you join in on that. And in the afternoon, we'll be doing some movement, dance, and Pilates with 7 Kid at 2 p.m. So make sure to join in on our last Wellness Wednesday. And Thursday, our last day, we'll be doing the UROC Tribe Wellness Coalition Net Tender Narcan training. So if you haven't taken the training yet, or someone you know hasn't taken it, make sure you join in on that. It's a great way to get your Narcan and your certification to carry Narcan. And there is incentives for going, so make sure you join in on that Thursday morning. And we'll close out with our closeout event at actually 3 p.m. on Zoom, and we'll be doing a goodbye and announcing our raffles and just thanking everyone, our presenters, our planning team, and all of those who joined us. So make sure you join in on our last week. We'll be having some fun events, and we hope to see you. And again, just thank you to our presenter. Wonderful presentation on resources, and the Resource Hub specifically, and we really appreciate having them today, as well as all of those who joined in and watched. Thank you all. If you want some more information for our event, check out the Wellness and Recovery Series Facebook page. If you want more information about the RX Safe Del Norte Coalition, you can check out the RX Safe Del Norte website, as well as our RX Safe Del Norte Facebook page. As always, there is an evaluation form at the end of this presentation. We ask that everyone who joined us today fill it out and submit it, because it is an entry into our raffle and it helps us out. So if you could fill out the evaluation form, we appreciate it. It will be available in the chat. And yeah, I just want to say thank you again to everyone joining us today, and we appreciate having you as always, and have a wonderful afternoon. Thank you.